Alright.
Kind of protective of my iPad.
I got you. Good. So just ask the question. That way I can pick it up.
Okay. What makes it convenient for patients to come to Complete Care?
Complete Care is primarily a family practice facility, so we see patients of all age groups, starting from infants, toddlers, adults, and geriatric patients, which are the elderly population.
Okay. How was her eyes? She kept looking up at you. Was that?
Let's try it one more time. Look at her.
Yeah.
Okay.
Yeah. Don't look at
Ignore
the
this.
camera.
Okay.
You're
or
talking
him.
to her.
Okay.
Yeah, because we're gonna get like a side view. I kept seeing her eyes pop over there.
Okay.
You're talking to her, not me. I'm not here.
Yeah. It's a figment of your
This is
imagination.
not here. Yeah. As invisible as I am at work.
Yeah, he's very invisible at work. Okay, I'll ask you again. What makes it convenient for patients to come to Complete Care?
Complete Care is primarily a family practice facility, so we see patients of all age groups, starting from infants, teenagers, adults, and the elderly population, the geriatric patients as well.
Okay, thank you. And why do patients choose you?
I'm a geriatrician, and geriatrician is primarily the physician who deals with the elderly population starting from the age of 65 and above. So although we do focus on all the chronic issues and medical conditions, but my main focus is on their functional ability, their quality of life issues, and all that kind of stuff. And also, as we are dealing with all the chronic illnesses, polypharmacy is one of the major issues, and we come up with a good drug regimen with the least drug interactions for those elderly patient population. And I also want to add that since so many primary care physicians, they are not taking Medicare, and geriatric patients are the patients who have Medicare, and they are very welcomed in our facility here.
Okay,
Perfect.
perfect. Anything else you need?
Was there any more questions?
Well, we're not going to do the other two because they actually are more.
So
for
do
the
we
family
have to
side.
do it again? It was okay.
Because some people may not know the difference of why they should see her over another practitioner.
Mm-hmm.
That is a good question because I don't know why.
Even it didn't explain that much.
Well, I know that you're older, but if
Yeah.
I'm 65 years old, why would I want to come see you versus going to see my regular gynecologist or my regular family doctor?
Mm-hmm.
What makes you special?
Okay. Well, in that case, as we grow older, our body physiology changes, and a geriatrician is well trained of doing a comprehensive medical physical exams, and they know what medical issues that patient population has to face, and they are very well aware how to deal with that. And they usually focus on their functional levels and their quality of life issues and their independence issues, which are also the main concern for that population. So we are, as a geriatrician, we know how to deal with that as compared to other primary care physicians.
Very good. Very good.
We're ready to go.
Ready?
Let me scratch a minute, hang on.
Get that for the outtake. The
Okay.
Christmas party. Why do patients choose you?
Well, I hope they choose me and hopefully choose this clinic for a lot of reasons. We have a lot of experience. We have two family practitioners and two really excellent nurse practitioners to support our patient care here. It's a great location. I think it's a convenient location. We've got extended hours, and between the two physicians and the two nurse practitioners, we have a lot of experience with what families need.
Good. What makes it convenient for patients to come to Complete Care?
I think we're in a great location for one thing. It's readily accessible from all over Odessa. It's readily accessible from Midland. And we have some extended hours. We're open till 8 o'clock in the evening most of the year. So, when those kids are sick after school or when they're sick when mom picks them up from daycare, it's a convenient place to pop in and see if we have that didn't work out very well. It's what makes this clinic convenient is our location. It's readily available, readily accessible from all over Odessa, and readily accessible from Midland. We also have extended hours till 8 o'clock in the evening, so when something happens to you later in the day or those kids are sick when they get out of school in the afternoon, it's nice to be able to have someplace to go.
Good. What age patients do you see?
This clinic covers everything from newborns. I do newborns in the hospital, and we do through geriatrics. I even do nursing home care in some cases. A wide variety. We treat men, we treat women, we treat the entire family, adults and children. Tremendous amount of well woman annual exams, hormones, birth control, hormone replacement after menopause, really a vast spectrum of family medical needs.
Good, checking out some of those hormones.
Yeah. Are you hot flashing? No.
It's 100 degrees outside, Dr. Ackerman. Everyone's hot flashing.
Yeah.
What are the most common reasons people come to see the doctor?
Well, hopefully more and more people are come to see the doctor for preventive reasons. You know, it's like the reasons you go get your oil changed or your tires checked before it turns into a problem. So, you know, those examinations and well checkups before there's anything seriously wrong, catching up on immunizations, getting advice from the doctor about lifestyle things, diet things, exercise, weight issues. Preventive medical care is really one of the things that we're fairly passionate around here. Clearly the illnesses, when your children are sick, when adults are sick, we deal with plenty of adults that have long-term chronic medical problems such as diabetes and heart disease and hypertension and asthma, and a real full spectrum of primary care, family practice, family-based medical needs.
Okay, and if I need to make an appointment, how far out are you booked? Can I get an appointment today?
Well, those of us that have a little more seasoned in the profession have a little bit tighter schedule on any given day, but between the two doctors and the nurse practitioners, you can almost always get a same-day appointment. And again, if you're pursuing your medical care from a long-term preventive and you're making that relationship with a doctor, it's just always good to make an appointment and get established so that when you do need something that we won't have any trouble getting you in. But it's almost always a day or two before you can get an appointment, so pretty quickly.
Anything else?
Covered?
Huh?
You covered it.
I covered it.
You good?
I'm the bomb. I know what I'm doing.
The bomb.